A rural doctor risks everything to save a hiker's life, then loses his clinic. What happened next shocked an entire community. I never thought a simple act of kindness could destroy someone's life, until I learned about Dr. James Miller. This small-town physician gave up everything to help a stranger, and the price he paid will leave you wondering about the state of our healthcare system. 20 miles outside of Pinecrest, Montana, nestled between towering mountains and sprawling forests, sits a town most people have never heard of. Cedar Ridge, population 1,842. For 3 decades, Dr. James Miller ran the only medical clinic within 50 miles. His modest facility wasn't fancy, just 4 exam rooms, basic equipment, and a small staff of 3. But for the people of Cedar Ridge and surrounding communities, Miller's clinic was a lifeline. James Miller wasn't your typical doctor. After graduating from medical school in the early 90s, he turned down lucrative offers from prestigious hospitals in Seattle and Portland. Instead, he returned to his hometown, determined to provide care to a community that desperately needed it. His clinic charged what patients could afford, often accepting payment in the form of homemade preserves, firewood, or sometimes nothing at all. Medicine isn't about profit, he once told the local newspaper. It's about taking care of your neighbors. Those weren't just empty words. Dr. Miller lived them every single day, working 60-hour weeks, making house calls to elderly patients who couldn't travel, and showing up at all hours when emergencies struck. Cedar Ridge didn't have an emergency room or hospital. They had Dr. Miller. On a crisp October morning last year, as the aspens turned golden and the first dusting of snow capped the mountains, 32-year-old Mark Sanderson set out alone on the Eagle Peak Trail. An experienced hiker from Chicago visiting the area, Sanderson had tackled much more challenging terrain before. But nature is unpredictable, and halfway up the mountain, disaster struck. A loose rock, a 15-foot fall, a shattered tibia that punctured through skin. Alone, miles from the trailhead, with no cell service and losing blood, Sanderson might have died there if not for a stroke of incredible luck. 2 local teenagers, skipping school to fish at a nearby lake, heard his cries for help. They couldn't carry him down the steep terrain, but one stayed while the other ran for help. By the time Sanderson arrived at Dr. Miller's clinic 4 hours later, carried down the mountain by volunteer rescue workers, he was in shock, his leg badly infected, and his condition deteriorating rapidly. The nearest hospital was over an hour away through winding mountain roads. Dr. Miller knew Sanderson wouldn't make it that far. "We're going to have to treat him here," he told his staff. "Call everyone, we need all hands on deck." What happened over the next 12 hours was nothing short of miraculous. Working with limited equipment, Dr. Miller and his small team stabilized Sanderson, cleaned and debrided his wound, set his complex fracture using makeshift orthopedic tools, administered antibiotics to fight the raging infection, and controlled his pain. They worked through the night, monitoring his vitals, transfusing the only 2 units of blood they had in stock, and refusing to give up even when things looked bleak. By morning, Sanderson was stable enough for transport. He was airlifted to a trauma center in Missoula, where surgeons were astounded by the quality of care he'd received in such primitive conditions. "If not for Dr. Miller's intervention," the trauma surgeon later wrote, "Mr. Sanderson would almost certainly have lost his leg, if not his life." Mark Sanderson survived. He kept his leg, and after multiple surgeries and months of physical therapy, he even hiked again. It should have been a story with a happy ending, a testament to the power of rural medicine and one doctor's exceptional skill and dedication. But what happened next reveals the broken reality of American healthcare. When Mark Sanderson was admitted to Dr. Miller's clinic, he was unconscious. He carried no ID, no insurance card, just a cell phone with a dead battery. There was no way to identify him or determine his insurance status. And in that moment, it didn't matter to Dr. Miller. He had a patient who needed care. The treatment Sanderson received cost the small clinic an estimated $18,000 in supplies, medication, and staff overtime. For a facility already operating on razor-thin margins, it was a significant expense, but one Dr. Miller never questioned. 2 weeks later, the clinic received devastating news. MontanaCare, the insurance company holding their primary contract, was auditing them due to irregular billing practices. The investigation focused on several cases where the clinic had provided care without proper insurance verification, including Sanderson's emergency treatment. The contract clearly states that except in cases where delay would result in death, providers must verify insurance coverage before administering non-emergency care, the letter from MontanaCare stated. Dr. Miller argued that Sanderson's case absolutely was life-threatening, a position later supported by the trauma surgeons who treated him. But MontanaCare disagreed. According to their review, which was conducted by administrators with no medical training, Sanderson could have been stabilized and transferred to the hospital in Missoula. The reality was that Sanderson didn't have MontanaCare insurance anyway. He had coverage through an Illinois provider that would have paid for his emergency care. But the paperwork hadn't been processed correctly, and in the confusion of the emergency, proper protocols weren't followed. It wasn't just Sanderson's case. The audit uncovered 12 other instances over the previous 3 years where the clinic had provided care without proper insurance verification. Many involved elderly patients who forgot their insurance cards, children brought in by grandparents who didn't have all their paperwork, or emergency situations where paperwork wasn't the priority. In each case, Dr. Miller had made the same decision: treat first, worry about paperwork later. It was an approach born from compassion rather than business sense, and it was about to cost him everything. MontanaCare retroactively denied payment for all 13 cases, demanding repayment of $157,000. For a small rural clinic already struggling to keep its doors open, it was a death sentence. "I can't believe this is happening," Dr. Miller told his staff, his voice breaking as he delivered the news. "We saved a man's life and now we're being punished for it." The community rallied. Bake sales, benefit concerts, and GoFundMe campaigns raised nearly $43,000, an impressive sum for a town where the median income hovers around $35,000 a year. Mark Sanderson, now recovered, contributed $25,000 of his own money when he learned what was happening. But it wasn't enough. Legal battles drained what little resources remained. 6 months after treating Mark Sanderson, Dr. James Miller closed the doors of his clinic for the last time. 30 years of service to his community ended not with celebration but with cardboard boxes and tears. The impact was immediate and devastating. For routine care, residents now had to drive 50 miles to the nearest clinic. For emergencies, they faced an hour-long journey to Missoula assuming roads were passable. For the elderly, the disabled, and those without reliable transportation, healthcare suddenly became inaccessible. Cedar Ridge wasn't alone. Across America, rural healthcare facilities are disappearing at an alarming rate. Since 2010, over 130 rural hospitals have closed, leaving more than 20 million Americans in healthcare deserts. The average rural hospital operates on a 1.8% profit margin, constantly teetering on the edge of financial collapse. The story of Dr. Miller's clinic might have ended there, another statistic in the slow-motion collapse of rural healthcare in America. But sometimes, when systems fail, individuals step up. 3 weeks after the clinic closed, Dr. Sarah Chen, a physician at Missoula General Hospital, made the hour-long drive to Cedar Ridge. She'd heard about Dr. Miller's situation and wanted to see the impact firsthand. What she found shocked her. Elderly patients rationing medications because they couldn't make the trip to refill prescriptions. A child with untreated strep throat because her single mother couldn't take a day off work to drive to Missoula. A diabetic man showing early signs of infection in his foot, a condition that could lead to amputation if left untreated. Chen returned to Missoula determined to do something. She rallied her colleagues, presenting data on the health crisis unfolding just an hour away. She reached out to medical suppliers, pharmaceutical companies, and neighboring hospitals. "This isn't about politics or profit," she told them. "This is about people dying from treatable conditions simply because they live in the wrong zip code." The response surprised everyone, including Chen herself. 20 doctors from 3 hospitals volunteered to rotate shifts in Cedar Ridge. Medical suppliers donated equipment. Pharmaceutical companies provided medication samples. A lawyer offered pro bono services to navigate regulatory hurdles. On a snowy December morning, just 7 weeks after Dr. Miller's clinic closed, a convoy of 8 vehicles made its way along the winding road to Cedar Ridge. They carried doctors, nurses, medical supplies, and hope. The town's community center was quickly transformed into a makeshift clinic. They planned to operate for 1 weekend, expecting perhaps 50 patients. By Sunday evening, they had seen 173. The need was overwhelming, Dr. Chen later recalled. People lined up 3 hours before we opened. Some walked miles in the snow. An elderly couple spent the night in their car to make sure they wouldn't miss us. What was intended as a one-time emergency intervention has since evolved into something more permanent. The Cedar Ridge Community Health Initiative now operates out of the former hardware store on Main Street. Volunteer physicians rotate through every weekend. A telemedicine program connects patients with specialists during the week. A medication delivery service ensures the most vulnerable residents don't go without essential treatments. It's not a perfect solution. The facility isn't equipped for complex emergencies. Chronic conditions still go undertreated, but it's a lifeline for a community that was drowning. The story has drawn attention far beyond Montana's borders. Healthcare advocates cite Cedar Ridge as both a warning and an inspiration, evidence of how quickly rural healthcare can collapse, but also how communities and compassionate medical professionals can create innovative solutions. Dr. Miller now works at an urgent care center in Missoula. He makes the drive to Cedar Ridge most weekends to volunteer at the new clinic. The legal battles with Montana Care continue, but a recent ruling suggests he might eventually be vindicated. I lost my clinic, but what's happening now is bigger than anything I could have built alone, he reflects. Sometimes things have to break completely before they can be rebuilt the right way. Mark Sanderson has become an unlikely advocate for rural healthcare reform. His viral social media posts about Dr. Miller's situation caught the attention of several state legislators, who are now proposing changes to insurance regulations to prevent similar situations in the future. I owe my life to a doctor who put my needs above paperwork, Sanderson says. The fact that he was punished for it should outrage every American. The Cedar Ridge story reveals painful truths about healthcare in America. It exposes how bureaucracy often trumps compassion, how rural communities are disproportionately vulnerable, and how quickly access to healthcare can disappear. But it also reveals something else, the extraordinary power of human connection and community. When systems fail, people step up. When institutions abandon their responsibilities, individuals create alternatives. When profit-driven decisions threaten lives, compassion finds a way forward. This isn't just a story about healthcare. It's about what we value as a society and what we're willing to fight for. It's about the kind of communities we want to build and the kind of neighbors we choose to be. What happened in Cedar Ridge is both heartbreaking and hopeful. A doctor lost everything because he put a patient's life above paperwork. A community lost its only medical facility because insurance companies valued protocols over people. But in that loss, something new and potentially more powerful emerged. A grassroots healthcare model built on volunteer spirit, professional dedication, and the simple belief that everyone deserves care, regardless of where they live or how much money they have. 365 days after the closure of Dr. Miller's clinic, the Cedar Ridge Community Health Initiative celebrated a remarkable milestone. They had provided care to over 4,000 patients. They had prevented countless emergency situations through preventative care and early intervention. They had demonstrated that when traditional systems fail, innovative alternatives can emerge. But challenges remain. Volunteer burnout threatens sustainability. Funding relies heavily on donations that could dry up. The facility still lacks essential equipment for true emergency care. Most troubling of all, similar healthcare deserts are spreading across rural America, and not every community is fortunate enough to have a Dr. Chen or Dr. Miller fighting for them. The Cedar Ridge story isn't over. In many ways, it's just beginning. The questions it raises about our healthcare system demand answers. The model it presents offers hope, but requires refinement and support to be truly sustainable. As for Dr. Miller, he no longer sees his story as a tragedy. What happened to me was wrong, he says, but what grew from it might help thousands more people than I could have treated alone. Sometimes you have to lose everything to discover what really matters. Mark Sanderson, now fully recovered, returns to Cedar Ridge every October to hike Eagle Peak Trail, not despite his accident, but because of it. That mountain changed my life, he explains. It connected me to a community and a cause I never would have known otherwise. At the top of the trail, there's now a small plaque that hikers often miss unless they know to look for it. It reads simply, "Compassion has no billing code." In rural communities across America, healthcare remains in crisis. Insurance companies still prioritize protocols over patients. Paperwork still outweighs people. But in one small Montana town, a different approach is taking root, one that prioritizes community over cost, care over credentials, and human connection over corporate policies. It's not perfect, it's not complete, but it's a start. And as Dr. Chen says at the end of every volunteer orientation, sometimes the most powerful medicine isn't found in pills or procedures. It's found in people who refuse to look away when systems fail. The Cedar Ridge story reminds us that healthcare isn't just a service or an industry. It's a fundamental human right. And when that right is threatened, it falls to each of us to stand up, speak out, and find new ways to care for each other. In Dr. Miller's office, now a community gathering space in the back of the clinic, hangs a framed letter from a patient whose life was saved during that first weekend the volunteer clinic operated. The last line reads, "You showed me that even when institutions fail, humanity doesn't have to." Perhaps that's the most important lesson from Cedar Ridge, that systems may break, but people don't have to. That compassion can find a way, even when corporations and bureaucracies stand in its path. That sometimes the deepest healing happens not despite our broken healthcare system, but in the very act of coming together to repair it. As we face healthcare challenges that sometimes seem insurmountable, Cedar Ridge stands as both a warning and a beacon, showing us how quickly access can disappear, but also how determined communities can create something new from the ruins of what failed them. If this story moved you, hit subscribe to learn about other communities finding innovative solutions to America's biggest challenges. Our next video explores a dying coal town that reinvented itself through renewable energy, and it might just change how you think about rural America.